This Puerto Rican.
All right, testing 1 2, testing 1 2. All right, guys, welcome to today's episode of Let's Talk About Poop podcast, where we go into a deep dive about what we can do to help out with your gut health. I'm excited about today's video because today we're going to do a deep dive on all you need to know when it comes to IBS and dietary options. We'll discuss my recommendations as a Mayo Clinic trained GI doctor when it comes to dietary options and your IBS, and we'll discuss your questions live when it comes to IBS as well. So if you're watching for the first time, my name is Dr. Islam, or if you're listening for the first time, my name is Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic of over 10 years of treating thousands of patients with IBS. We are experts on this. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you live here locally, come see us up at Gastro for all your GI needs. And if you don't live here locally, consider subscribing to my newsletter and my podcast as well. So the way this works is that initially, in the very beginning of the podcast, I do a deep dive on a topic. And if you're watching the live stream, I answer your questions you guys have live as well. So without further delay, let's discuss my recommendations when it comes to IBS and what you can do with respect to your diet. So before we begin, I want to kind of stress how diet can and not play a role when it comes to IBS. So a lot of patients come see me for their IBS issues, pain, bloating, distension, diarrhea. And a lot of people ask me, hey, Dr. Islam, what are some dietary options to get my IBS better controlled? And so when someone asks me that, I understand where they're coming from, because commonly we try to see what we can do to help out with your gut issues naturally. I'm all about finding the right approach naturally to help improve your gut issues to get you feeling better as well. However, when it comes to IBS, I have to stress to my patients that when you look at the research, the data about those individuals that do benefit from IBS, it's not a big percentage. Mainly just 10 to 15%, sometimes maybe as high as 20% will respond to dietary options completely when it comes to treating your IBS. Why is that the case? Well, the main reason is that IBS is a multifactorial disease. It's not just a dietary option when it comes to your disease, meaning there are so many different factors that play a role when it comes to IBS. And this is why a lot of my patients may not respond completely to their IBS symptoms. Now, some do, but a lot of them don't, because there's so many other factors being involved. It involves dietary options, dietary changes, stress, gut microbiome, leaky gut, a change in the motility of your GI tract, what happened whenever you were younger. These things all play a role when it comes to developing and causing and treating IBS. And diet plays one small role, but it may not be the comprehensive role. So this is why when it comes to my patients, I don't try to give you a dietary option as the only treatment, because we know that when it comes to IBS is not a dietary fix that's going to make you feel better like it would for lactose intolerance or problems like that. We know with IBS, it can be so many different factors that play a role in interaction that it's hard to pinpoint one role. The other thing I have to stress when it comes to IBS is that not everyone's going to benefit from dietary changes. You're not. And you will know very quickly within the first couple of weeks if you are one of those individuals that will benefit from dietary changes, because I don't want you to be stuck on a diet and then come to realize that this diet is not the right diet for you. And I don't want you to continue something that's not going to get you the benefit that you need. And the last thing I want to stress is that there are so many dietary options that are out there now that can be very confusing for a lot of my patients. And so I'm going to give you kind of my recommendations generally, but you in particular may have different options that may work best for you in particular. So here are a couple of things I want to recommend. So when it comes to dietary options and IBS, we know there are 3 trigger foods that tend to find that comprehensively can affect individuals who have IBS. One of them are foods that are high in FODMAPs. So you may have heard of this term. I have a lot of videos on this. But FODMAP stands for fermentable oligosaccharides, monosaccharides, disaccharides, and polyphenols. These are certain carbohydrates and sugars and starches that are known to cause bloating and distension to occur. They're common triggers for IBS, for diarrhea, for bloating, for abdominal pain. And we know that foods that are high on this can make your gut issues worse. So these include foods that you may think are healthy for you, like onions, Apples, pears, pineapples. These are foods that are typically good for most individuals, which we want to encourage. But for those that have IBS, it can make their symptoms a lot worse. It can make it more difficult to occur because you don't have the capability sometimes to digest these foods, which can cause you to have the symptoms from IBS. So we know that foods that are high in FODMAPs tend to trigger IBS. So we try to minimize some of those foods as much as we can. Another class of foods that I try to eliminate for all my patients who have IBS are dairy products. A lot of individuals don't realize that they are lactose intolerant. I didn't know this for the longest time. And lactose intolerance is one of those intolerances that can occur over time as you get older. Meaning you could have had dairy when you were younger, you could have ice cream when you were younger, had no issues. But as you get older and you start to develop the intolerance because you lose the enzyme, you actually can become lactose intolerant. And so I tell all my patients with IBS, eliminate dairy. Any of my bloating patients, eliminate dairy. I don't care if you don't think you're lactose intolerant. You actually may be, you don't realize that. So this includes things like cheese, milk, ice cream, anything, yogurt, even some certain yogurts may be difficult for you to ingest because you don't have the enzyme to metabolize dairy. So I tell all my patients who have IBS, eliminate dairy. The third common trigger food, which you may not be aware of, are artificial sweeteners. So artificial sweeteners, as the name suggests, are different ways to produce and to ingest foods that are sweet and other things that are sweet without actually ingesting the sugar. They're no calorie. But a lot of my IBS patients don't realize they can't metabolize these artificial sweeteners. So as soon as it goes into the gut, it can explode and cause a lot of gas, bloating, and distension to occur. So common one, sorbitol, which you may see in certain artificial sweeteners. So certain drinks, diet drinks, maybe chewing gum, and actual artificial sweeteners you would put into your coffee or your tea can actually make your gut issues a lot worse. So I also tell all my patients who have IBS to minimize those foods as much as you can. Now, once again, these are general recommendations that I give to my IBS patients when it comes to adjusting their diet. And then based on that, you can make different changes that are particular to you. So now that we talked about some of the foods that I recommend to avoid, let me talk about some of the foods I want to recommend for you to incorporate. These are foods that I recommend for all my IBS patients to help out when it comes to your IBS symptoms, because incorporating these foods might make you feel a lot better as well. So the first thing I always recommend is soluble fiber. Soluble fiber is the foundation for gut health. It's also the foundation for IBS. So you want to look for the term called psyllium. This is important because psyllium is the soluble fiber that you want to aim for. Now, the important thing when it comes to fiber, especially for my IBS patients, is that you need to go low and you need to go slow, and that's critical because your gut microbiome already is not working correctly when you have IBS. Sometimes it could be too much bad bacteria. It could be alteration in the type of bacteria, but when you start to ingest fiber, commonly, the most common complaint I get from my patients is that they get a lot of bloating, distension. They can't handle the fiber. It's not that you can't handle the fiber, it's that your body is so used to not having that much fiber that it just interacts in a way that's not healthy for you. So go low and go slow and aim for the synthetic fibers. So things like benefiber, citrucil. These are the fibers that are easier to tolerate, that are easier to digest, especially if you notice you've had IBS issues and fiber made things worse for you as well. Number 2 is peppermint. Peppermint is fantastic and it's great for IBS. I actually had a patient today who came to see me who we diagnosed her with IBS, and she had a lot of abdominal pain and she couldn't figure out what she can do. And so I gave her an option as peppermint as an option to naturally treat your gut issues when it comes to IBS. Peppermint's been around for thousands of years. It's pretty much in every single country and every culture to help soothe your gut to get you feeling better. And so peppermint is an effective option to naturally incorporate into your diet. I recommend a peppermint pill called IB Guard. I don't make any money from this, but it's specifically released in the gut to help soothe the gut and get you feeling better. The biggest side effect when it comes to peppermint is a lot of heartburn and regurgitation. This can make things a lot worse. What peppermint does is not only does it soothe your stomach, it actually relaxes the sphincter between the esophagus and stomach to make heartburn symptoms a lot more difficult to manage, to make it a lot worse as well. So this is something that can make things a lot more difficult for you when it comes to dealing with heartburn if you happen to have that. And then lastly, ginger. Ginger is fantastic. I recommend ginger tea, ginger root. These are very effective options when it comes to IBS to get you feeling better and to manage your symptoms and hopefully get things taken care of for you as well. So these are the 3 things I recommend for all my IBS patients who are having issues when it comes to gut issues to incorporate what you can. And once again, we have a lot more videos and a lot more recommendations on specifics that I recommend to get you feeling better and get you taken care of. Now, I talked about some of the options when it comes to IBS. One of the most important things that we want to stress when it comes to treating IBS is the gut-brain axis. So this is a real connection between the brain and the gut, and this tends to be overlooked for a lot of physicians, practitioners, and also patients as well. So we are seeing more and more individuals in which the gut-brain axis is actually the reason why you're having a lot of your issues. Your brain and your gut are like besties. They're like hanging out all the time. They're talking all the time. They're chilling all the time. But when one of them acts a fool, the other one's going to act a fool as well. And this is very common. And so sometimes that connection between the brain and the gut can be the reason why you're having so many issues. And we try to delve with this with different options to get you feeling better. And so the best example I have is that if you're always thinking about your gut, you're going to be stressed. And that stress over time is going to make your gut issues worse, which in turn will make you more stressed, which ends up being just this vicious cycle of the connection and the communication between the brain and your gut that becomes maladaptive. And we have to sometimes break that cycle to make it better for you as well. And there are a lot of ways we can break that cycle. Sometimes we can give you options like cognitive behavioral therapy, seeing a psychologist or a psychiatrist, sometimes doing things like meditation or yoga or exercise. But often we have to give you medication to help soothe the mind, to help soothe the gut. And a lot of my patients are shocked that I may be prescribing them a low-dose antidepressant for their gut issues. And the reason I'm doing this is to try to break that connection between the brain and the gut to get your mind calm and to get your gut calm as well. But what I need from my patients is to tell me, hey, I do feel anxiety. I do feel depression. I do feel anxious, because that's going to allow me to tailor how I can treat you better. Because it may not be the gut that's driving your symptoms. It actually may be the brain that's driving your symptoms as well. But you live with yourself all the time. I may only see you for a short time in a visit. I may not be able to get that sense. But whenever you start to realize that, hey, I think my anxiety is driving my gut issues, that's important for me to hear, because then I may want to tailor therapy to that to get your gut issues taken care of. And by doing that, we're actually able to manage and hit the gut-brain axis, which will hopefully get your IBS taken care of. And so if you've tried dietary options, you've tried medical options, but you don't quite get the response that you want, maybe talk to your doctor about what you can do from a gut-brain standpoint to get you feeling better. And obviously, come see us, Love Gastro. We can find out what's going on and get your gut-brain taken care of as well. So today's topic, we're going to do a lot more on IBS. Let's go to the second part. We'll answer the live questions. So here's one. Hey, Dr. Islam, can stress make your IBS symptoms worse? And the answer is 100% it can. Not only can stress make your IBS symptoms worse, it can make a lot of other gut issues a lot more worse as well. When you're stressed, you have an increase of cortisol. You have a change in neurotransmitters. You have the communication between the brain and the gut that occurs on hyperdrive, and this will drive gut issues and make things a lot more difficult to manage. And so for a lot of my patients that have a lot of stress going on, absolutely, this will drive your gut issues, get you feeling worse, also make things a lot more difficult for you as well. So 100% can. This is why for a lot of my patients, we actually may recommend maybe seeing somebody who specializes in dealing with your stress, or maybe we'll try cognitive behavioral therapy, gut-directed hypnotherapy, or maybe even medical options to get you feeling better as well. Great question. All right, next question. Perfect. So one question was asked, hey, Dr. Islam, can IBS cause colitis? This is a very good question. The answer to this question is no, it cannot. So colitis is actually an inflammation going on inside the colon that's usually triggered by some sort of event, whether it's an autoimmune disease like ulcerative colitis, whether it's an infection like an infectious colitis or C. diff, whether it's ischemia or lack of blood flow causing ischemic colitis, there's a actual trigger when it comes to colitis, but not for IBS. IBS is not a trigger when it comes to colitis. So if you've been diagnosed with colitis, the question is obviously, how are you diagnosed? Can we confirm this? But also the question is why? Why are you diagnosed with colitis? Because it should not be due to IBS. There are two separate things going on that may cause different modalities of treatment and different options to get those fixed up and taken care of as well. Great question. All right, let me go on my TikTok here and see if we have anybody who has any live questions as well. All right, here, perfect. All right, that's good. I think all the questions were asked on TikTok. Oh, another question comes up. Hey, Dr. Islam, what role do probiotics and prebiotics happen or occur when it comes to IBS? I love this question because it brings in my favorite topic, which is the gut microbiome. So we do know that for some IBS patients, the main trigger of their symptoms is the gut microbiome. The change in the gut bacteria, with the trillion of bacteria that are there, that change can drive why you're having some of your IBS issues. And we also know that incorporating more probiotic foods and prebiotic foods can make things better for your gut. So for anyone who has IBS, I do encourage you adding these prebiotic foods and probiotic foods as much as you can. So fermented foods are a fantastic source of probiotics and prebiotics that can change your gut microbiome and get you feeling better. Adding more fiber, especially plant fiber, is also a very effective option to help out when it comes to your IBS to get you feeling better as well. Sometimes adding some probiotic pills for some individuals can get them feeling better as well. So finding a high quality probiotic pill can help out. And so absolutely, if there are ways you can incorporate more prebiotics and probiotic foods, this will make things better for you as well. All right, let me see if there's any more questions I have here. All right, next question here. What sugar substitute can I use for IBS and diabetes? This is a great question. So stevia and monk fruit tend to be more of a natural sugar that for some of my patients that you don't get the side effects of bloating and distension with that. So if you want to try some sugar, these may be the sugars you can use instead that may not trigger your IBS symptoms. The ones to avoid are typically Splenda and Sweet and Low. These are the ones that are made with some of the sugar substitutes that are more difficult to digest, that can cause a lot of bloating and distension to occur as well. So kind of keep that in mind if you're trying to do what type of sugar you want to try and incorporate when it comes to your gut issues to get you feeling better as well. All right, next question here. Ozempic and IBS flare. Does Ozempic make your IBS worse? And this is an excellent question. So let's kind of go into a small little deep dive on these GLP-1 medications. So Ozempic and medications like this, like Wegovy and all some of the other ones, what they basically do is that they slow down your gut. They slow down the motility of your GI tract. And by doing that, you don't feel hungry as often, you get fuller more quicker, and because of that, you're losing weight. Now, as a consequence of that, you have a lot of gut issues from that. And so for my patients with IBS, especially constipation, predominant IBS, 100% it will make your IBS symptoms worse. It will slow down the motility of your gut, make it harder for things to pass through, and make your constipation worse. Number two is that can also make abdominal pain worse as well because you're not moving things along. Stool just sits in your gut. And when the stool sits in your gut, you develop distension, pain, and you just don't feel very, very good. So it absolutely can make constipation issues worse. But on the flip side, for my patients with diarrhea, it can actually make their diarrhea symptoms better. They feel better on these medications. And that's not uncommon because the slowing down effect of these medications, they'll make things a lot harder for you to have a bowel movement, which for my diarrhea patients can make things better as well. Great question. All right, here, next question I'm seeing on the live stream. Great questions here. So questions asked, what is the root cause of SIBO, small intestinal bacterial overgrowth? Great question. All right, let me do a video or a deep dive on, or a small dive on SIBO. So SIBO is small intestinal bacterial overgrowth. What this basically is, this is an abnormal growth of bad bacteria in the small intestine that can cause bloating, distension, diarrhea, constipation, and methane predominant. It also can be a root cause for IBS as well. Now, currently, when it comes to the research of SIBO, we're really trying to tease out what is the cause, what is the root cause, what can it lead to, so we don't quite know the answer for this. Now, who can be predisposed to SIBO? Once again, this is an emerging field, which we're really getting some information on. Here's what we know. So number one, we know that diabetics are more at risk of developing SIBO because, in diabetes, you have a change in your gut microbiome, you have a change in the motility that can make things a lot more difficult to pass through, which can make these symptoms and SIBO symptoms worse. Number two, if you had a prior gastric surgery, that automatically predisposes you to develop SIBO. So whether it's a gastric bypass, a Roux-en-Y, these types of surgeries cause stasis of the gut that can make it more likely for you to develop SIBO to occur. Number three, a overall condition that will slow down your motility, so things like scleroderma, Crest syndrome. These autoimmune diseases automatically slow down the gut, which would make it more likely for you to develop SIBO. Number four, we know that certain medications possibly can increase your risk of developing SIBO. So I'm not going to go into details about this because the data is very unclear on this. We know that some medications can predispose you to develop SIBO. Then lastly, having a condition that can wipe out your gut microbiome can cause you to develop SIBO as well. So whether it's taking antibiotics, whether it's taking something to wipe out the normal gut flora, whether it's certain foods that are known to cause your bad bacteria to develop, these are some of the reasons why you can develop SIBO. Now, if you have SIBO, how do we diagnose this? 3 different ways. One is clinically. I can just see and based on your symptoms if you have SIBO or not and treat you empirically. It's very common to do, not a problem. Number 2, we actually get fluid from the small intestine itself, look at it on the microscope and see how much bad bacteria that's there. That's option number 2. Or we can do a breath test, which is what we do in our office. We actually have you breathe into a machine. We give you a substrate. We have you breathe into a machine, and we see if you have a rise in a certain bacteria abnormally in the small intestine. This allows me to see in a non-invasive fashion if you have SIBO or not. And so these are some of the reasons why you may develop SIBO, and these may be some of the ways that we can diagnose somebody with small intestinal bacterial overgrowth. All right, next question. Can you have mucus, or why do you have mucus in your stool? So I have a lot of videos on this. This is a great question. So mucus for some individuals can be normal and not a problem at all. It can be very, very normal to have. Not a big deal. And so if you're having mucus in your stool, that can be a normal finding. But for some individuals, it could be a sign of another condition called colitis or ulcerative colitis. So ulcerative colitis, or UC, is an autoimmune disease in which the body actually attacks the colon to cause inflammation to occur, especially in the rectum and the colon area. And when it gets inflamed, your colon can secrete out mucus as a consequence of that. So if you have mucus with associated bloody diarrhea itself, or blood in your stool, this perks up my ears that maybe you have ulcerative colitis as the cause for your mucus. Number 2, another cause of your mucus could be hemorrhoids. Big hemorrhoids in your bottom can cause mucus to occur because you're holding in that stool, and over time they'll cause mucus to come out as you're not cleaning yourself. And then number 3, IBS. IBS absolutely can also secrete out mucus in your stool because of the change of the lining of your gut. So there are a couple different reasons why. My recommendation to you is that if you're having mucus in your stool, come see someone like me so we can do an investigation, find out what's going on, get down to the bottom, literally, and hopefully get you feeling better as well. All right, guys. I think we did good. A lot of good questions today. I want to thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Don't forget also to tune in next week for my podcast. And if you want to find out what you can do to improve your health, subscribe to my channel, listen to my podcast, and also come see us at Gastro. We can find out what's going on, get down to the root cause, and get you feeling better. And thank you guys for watching. Look forward to seeing you guys on next week's podcast.